Good afternoon, everyone. I'm Nicole Hickl, your CBS 4 evening anchor for 5, 6, and 10. For those of you who follow me on my page, last week I took a big step. I broke my silence and revealed to my viewers and my coworkers, my family, friends, everyone that I was diagnosed with major depression, which I'm currently being treated for. I see a therapist. And for the first time in my life, I'm on medication. That was the first step that I wanted to take, is to admit that this is what I'm suffering from in hopes of helping other people who may be suffering. But I want to continue the conversation, and we're doing that today. With me today, I have Dr. Daniel Gutierrez, who is a psychiatrist and also the Chief Medical Officer for Tropical Texas Behavioral Health. Thank you so much for joining us.
Thank you, Nicole.
It's great to have you. And the one thing that I wanted to address in this first segment for our official Facebook Live for Mental Health Unmasked is just talking about the warning signs and symptoms that people display that they may be in need of help.
Okay. Well, depression presents in many ways, but one of the types of depression that we worry most about is one that we call major depressive disorder. And the reason why we are concerned about this is because it has a lot of negative consequences on how people feel, how they function, and how it affects their lives. So we want to identify it always and be able to treat it, because there's very good treatments for this type of depression. So when we're talking about major depression, we look at several symptoms. One of them is being depressed, feeling sad. Everybody goes through a day where something has happened, or maybe a couple of days where you have had a loss, or you've had a major problem in your life, and we feel sad about it. But this is a little bit different. This is something that a person knows that their mood is persistently down, sometimes going on for weeks or months at a time. So that's one of the symptoms that is different. It's there all day long. There's not a reason necessarily to be depressed. The person just feels that way all the time. So the mood is really important. Then there's other symptoms, and it has to do a lot of times with losing interest in things that you previously really enjoyed. So a person that was very interested in grooming or in going out or doing sports or whatever, all of a sudden loses interest in life or things that they really enjoy. We see this apathy towards life. There's some problems with the energy level. The person will feel that they feel tired all the time, and they can't go about and do the things that they typically would do. Even things like, taking care of your activities of daily living or your chores or your work. The person might have a lot of problems with their energy level. Sleep is usually one that's greatly affected. It can be from not being able to fall asleep to waking up during the night, or to waking up very early in the, let's say if a person typically wakes up at 7, all of a sudden they find themselves waking up at 4 in the morning and being wide awake. Trouble with appetite or changes in your eating habits or your weight. A person can gain or lose 5 or 10 pounds in a month due to not feeling hungry or wanting to eat too much. And there's other symptoms with concentration and focusing that sometimes affect how a person can do their job, like at school or at work, and so they're getting behind a lot on their activities that they do. Decreased self-esteem, the way a person views themselves. They might feel that they're worthless, or they're feeling that they're not up to what things that they felt really competent. All of a sudden they just don't feel that way. And last but not least, a lot of people that end up feeling depressed this way sometimes are feeling hopeless and helpless to the point where they feel, is life really worth living? Sometimes they'll have suicidal thoughts, sometimes they'll have suicide attempts, and that's one of the major concerns with this type of depression, so it can lead to not only an impairment in your daily functioning and really unwanted symptoms, but maybe leading to dangerous outcomes.
And what are some of the most common symptoms you see with some of your patients? You've treated adults, but currently you're treating adolescents, and many of them that come to you, they are saying that they're depressed.
Mm-hmm. Yes, sure. And obviously, being a child and adolescent psychiatrist, you have to take into account the development of where that person is. So certainly if you look at a 10-year-old child versus a 14-year-old versus a 18-year-old, they're at different developmental stages. So sometimes the presentation might be a little bit different, but you really go through those symptoms that I just mentioned. They will have those symptoms no matter how old they are.
Yeah, I think when I noticed that I was not myself is that I was sleeping all the time. Yes. I had to be at work at 2 p.m. and I would just sleep until the very last minute when I would have to what I call put on my mask, get ready, put on my makeup. That's why I wanted to call this segment Mental Health at a Mask, because a lot of people do wear masks, and I think there's a common misconception. Even me, it was harder to believe that there are other professionals out there that seek treatment, and it's we think that it might be a certain category of people, but depression is, no one's immune to it.
That's true, Nicole. And usually, people might think, oh, that happens to someone else.
Right.
I'm different. I have, a career, or I have a profession, or I'm successful, or, I come from a different type of family. So those thoughts are very common. So we really need to look at cultural issues that sometimes affect people, one, identifying these symptoms and not feeling like, well, you're just going through a stage and you'll grow out of it, or you'll get through it. And sometimes people do go through a difficult period and they get through it, and it might have been a very brief mood problem. But major depression usually persists. That's one of the things. It doesn't, you just don't say, I was depressed usually a week and then I'm back to normal. It rarely happens that way. It just usually keeps on going. And I think what you were saying about sleeping a lot can be due to different reasons. It could be due to just the sadness and you don't feel like you want to do it. It could be the energy level. It could be the lack of interest in things. And it could be just a sleep disturbance. So all those things can contribute to a person feeling that it's so hard to go out and face life and do the things that you have to do. So you want to stay in bed where you feel that you're protected.
Yes,
very true.
That is where I felt protected, which is why I would do it. And I want to go over, there's so many things that can trigger it. And whenever I revealed my depression, people are like, well, I wonder what it was. And there's just so many triggers.
There is. And so we don't know why people get depressed and why other people don't. So, it's kind of like, when you think about a person having risk factors for heart problems, right? So who gets a heart attack? Who doesn't get a heart attack? You say, well, people do have different risk factors. Some people didn't have any risk factors and they get a heart attack, right? At least apparently. The same thing happens with certain mental illnesses. The person say, well, I didn't see that coming. Where did this come from? Everything was going okay, and all of a sudden I feel depressed. Other people start experiencing some risk factors. There could be genetic risk factors where the person has, a family member suffered through this, and so there's some genetic component to it. There's definitely other issues, significant psychosocial stressors in your life, changes, losses, illnesses. And I don't want to forget medical problems. A lot of the times, we get someone that comes in and they always need maybe a physical and maybe some lab work, because things like thyroid problems or anemia or other health issues can look like depression. And so you want to make sure that you get a physical and some labs done to look at this evaluation. But there could be, I didn't mention trauma. Trauma is a major risk factor for depression. When people have gone through traumatic events in their life, and life is full of them. We look at the people from Puerto Rico that have gone through this horrible hurricane and have been at loss of a lot of things that were normal for them. And we've seen the incidence of post-traumatic stress disorder and depression in places where there's been collective impact on their way of life. So.
And would these triggers or the signs that we're talking about, would these be similar to people who suffer from bipolar disorder, anxiety?
Yes. One of the things is that, most mental health problems, one of the ways that I kind of simplify sometimes is that, a apple doesn't turn into a banana. right? It's always an apple, right? You will always be able to identify it. The same thing happens. So if you have, one disorder, that doesn't mean that if it gets worse, it will become another one. Now, you could have two or maybe more, and we call that comorbidity. Unfortunately, the people that suffer from one mental health problem are higher risk of developing comorbid other disorders. Right. So you can have major depression, you can have an anxiety disorder, but one doesn't convert into the other one. You have comorbid disorder. So bipolar disorder is a mood disorder. And that's the way, how that is different is that besides having those depressive episodes that I just mentioned, a person can all of a sudden be doing well for a year, 2 years, and all of a sudden have a mood swing to the other extreme. So you see the opposite. Instead of having low energy, the person has excessive energy. The person, instead of being calm and quiet and not wanting, they're very talkative, they talk very fast, very pressured. Instead of their self-esteem being down, it's on top of the world. They have all the powers and all the abilities that typically they don't feel that they have. They don't need to sleep. They can get by with 2 hours, 3 hours, and they're still very energetic, and their mood is usually euphoric instead of being depressed. And that type of what we call manic episode, unfortunately, the people that go through that can get to a point where they lose their judgment and insight. They can't see that they're doing. Everybody else can see it, but they can't see it. And so they don't seek treatment, and they refuse treatment. And that can lead to a lot of impulsive, very worrisome habits or behaviors that can get them into trouble in different aspects of their life.
So I think the hardest thing is for family members who are watching or see someone, they're like, I think they're going through something. What is the best way, or when should someone step in and be like, hey, are you okay? Like, what's going on?
Well, everybody's very busy with their lives, Nicole, and so sometimes we don't look at people that are right there beside us. We're too busy with our own expectations. So I think one is just being more attuned to what's going on around us, right? Being able to say, I noticed that you all of a sudden are a lot more quiet. I noticed that you want to be sleeping all the time. I noticed that, you look sad a lot. So I think identifying someone that we know that there's been a major change in their overall behavior and attitude, we can say, is something going on? I noticed these things that are different from how you usually are. And then that might open the conversation for the person to feel comfortable to say, yes, I don't know what's going on. I do feel different. This is going on with me. So yes, the family members, people that are close to you, can be usually the first persons to say, maybe there's something going on. Maybe we should go someplace for you to seek some treatment, right? And so that would be one way to identify. Or coworkers, friends, people will usually notice. We can say, if you're in a person that is attuned to your environment, you will notice that a person that you know and you see them at this level, there's something. Now, as you were saying earlier, sometimes we put on a mask originally, and we might show a happy or a normal, and then we go to our house and we let everything go there.
Yeah.
So that can happen too, but it's hard to keep that up. You can do that for a while, but eventually
it's exhausting to wear a mask.
Yes, it's exhausting. Yes,
it's really exhausting. So your advice to those who maybe they see one of their loved ones struggling is just to, talk to them, listen.
Listen, yes, listen. Most people want to share, when they're not feeling well. They feel that nobody cares. And remember that depression changes, if it starts going on for a while, it changes your cognitive abilities. You start seeing things in a different way. You see mountains when there's, something not that big. You tend to feel like the person's comment was directed to you, and you feel devastated when maybe when you're not feeling this way, we're joking around, it's not a big deal. Yeah. But things affect you more, and the way people feel and think really changes when you're depressed. And I think that's why it's so hard for the person to say, you know what, logically, this is not what's going on, I need to do this. Well, you don't think that way when you're depressed. Your thinking becomes a little bit more illogical.
Yeah, so. You had a lot of great points of talking about the warning signs, the symptoms, and before we go, I just want to thank our viewers who are watching this. This is an important topic. Unfortunately, there's this stigma of mental illness. Everyone's like, no, I'm fine. Like, you can't admit it. But it's so important to break that barrier. And I just want to talk to you, lastly, about what are people's options like. There's a lot of people who probably don't even know where to start.
Yeah. Well, I think one, like I said, is identifying. I think being able to say, there's a change in what's going on with me. I'm usually not this way. And I need to do something to get through this. So I think starting out with your support system, your family, your friends, talking to them, and you say, well, nothing's really changing. I'm still feeling just as bad as so maybe you need to look for some professional help. And you can get an assessment with a counselor, a psychologist, a psychiatrist, and kind of start there and say, what's going on? Maybe it's not depression. Maybe, like I said, maybe it's a medical condition that you need to treat. You can start with your family practitioner and say, what, I haven't been feeling quite myself. Right. And maybe that person could say, maybe you need to be referred to someone. I think family practitioners are becoming a lot more engaged as the gatekeepers of saying, I notice that there's something going on. Let me refer you to someone.
Right.
And that could be a good start. So, people have other support systems. Their clergymen or their support systems in the community. I think all those are very valuable. But once you get to that point that you said, well, I've talked to people, I do need professional help. Counseling there's certain types of counseling that are very important. I think one of them, that is important is to find someone that you feel listens to you, and tries to understand you and tries to help you. I think getting a counselor or a therapist that can be empathic and attuned to what your needs are is a very good start. And if hopefully that person would say, what, I've been seeing you for a few weeks, your depression seems to be getting worse, you should probably see a psychiatrist, right. Get an evaluation. Is medication an option? With medicines, the medicines for depression are very effective. There's 60, 70, 80% efficacy rates for most antidepressants, and so just on a first try. And they take sometimes 1 to 2 months to work, so you got to give it a little bit of time. And I think having someone explain to you the roadmap and say, you're not going to take 1 or 2 pills and feel great. It's going to take a few weeks.
Patience is key. Patience is key. Well, thank you so much, Dr. Gutierrez, for joining us and just starting the conversation. We really appreciate it.
Thank you, Nicole. It's a pleasure talking to you.
Of course. And this is a topic that we'll be covering every Fridays. So we will continue to discuss options for treatment, where you can go. There are several places that offer free counseling. And if there are any other topics that you'd like to discuss, or just reach out to me on my social media page. You can hit me on Twitter. I'm at Nicole KGBT. Also on Facebook, Nicole Hickl, CBS4. Thank you, everyone, for tuning in. Have a great, great day. Make someone smile today. Be positive, and we'll see you for the news for CBS 4 Valley at 5, 6, and 10.